Dr. Evan Layton, and I work over in the Riverview at my clinic. I work outpatient pediatrics. I've been working for 8 years now in pediatrics.
Yeah.
So, and I have no plans on leaving or doing anything else anytime soon. I phrase it a lot of times with parents is social media is a big part of it, but electronic use. Overall, just like screen time, it needs to be monitored, and there are certain age restrictions that, or not restrictions, but recommendations on when we start to allow for children to have unsupervised internet access at age 14, 16 for social media. We don't recommend any kid have social media till 16 years of age. And there are a lot of apps that tie in social media to it. The mental health epidemic is happening right now. The latest data, which I think is the most recent data, is 2021. 1 in 5 children have a mental health or behavioral disease or problem. And so it's a big problem. Boys are not quite as prevalent as teen girls, but depression, anxiety, obesity, these are all big factors. I believe 1 in 4 females of the adolescent age are affected by a mental health problem such as depression or anxiety or ADHD, which actually does tie into social media use and videos as well. On average, the American teenager and early adolescent, it often starts around 7 or 8 that the screen time use becomes outlandish in terms of how high it is. On average, the American child spends 9 hours of screen time every day. 9 hours. And they sleep, on average, less than 7 hours, where most everybody knows that 8 hours at a minimum is what's best for growth and development of their body and of their minds. So on average, they're spending 9 hours of screen time a day. And oftentimes when I see patients and they come ask me different things, and if they have a screening, we screen for depression and anxiety every teen health visit for the well child checks. If they have signs or symptoms of that, I often will ask them permission to look at their screen time on their phone, especially if they are not really listening to me and they're on their phone anyways. I don't see a teenager with less than 4 or 5 hours of screen time a day. I just don't. That's just not a thing. Most of the time, for even the highly athletic or highly involved children, they'll still have 7, 8, 9 hours of screen time a day, and they say they're working fine, and they just wake up tired a little bit because they're sleeping 6 or 7 hours a night. People don't know how much time they're wasting on screen time. TikTok and Facebook and Instagram, the Reels, they are one of the most addictive things ever. How affects their self-image? That's a very good question. That's a big deal. Social learning is a big part of growing up and learning. It's not just book learning, it's social learning. And there are 2 main strategies that children use. The conformist bias and the prestige bias as to who they want to model themselves after. And children do not simply model themselves after parents. They can a lot, but it is a losing strategy evolutionarily wise to only model themselves after their parents. Learning without social media, it'll take weeks often for you to observe that different people in different scenarios, acting different ways for you to really fully evaluate and judge who they are. However, social media, children can go through thousands of data points every single day with a numerical amount of how liked and how commented things are. It will give exact amount of prestige, an exact amount of what they need to conform to and what they need to model themselves after. But social media, to gain prestige, it's all about getting those numbers, getting those likes, getting the attention. And a lot of people conform to the car crash mentality. Be absurd, do something ridiculous, do something outlandish or attention getting. Not necessarily what's right or what's the good thing to do or to learn. It's more about entertainment value. And so social media has become the most efficient way of having children conform of all time. And it is very efficient. It's extremely efficient and addictive. It is a social feedback loop. Sean Parker, one of the makers of Facebook, back in 2017 said in an interview that doing this social media feedback loop of this endless scroll along with the likes and the comments and having that shown to everyone is exploiting basic human nature, and it is exactly what hackers like him wanted to utilize to get Facebook more addictive. They're utilizing strategies of the human psyche to make it so that they are more addictive and more used so that they can get more money.
Wow.
There's all sorts of red flags, but the most simple is if you can't get them off it for something also fun, for something that they generally like. Children, oftentimes, especially when I have toddlers or younger children that are hooked onto YouTube or video games or whatever on a tablet, and parents are using the tablet or the phone to distract them while they're waiting for me to come into the room. And then they try to take the tablet or phone away because I come into the room and I'm here to talk to them and try and get their information and see what's wrong. And they flip out and they freak out so frequently. That is a red flag. Signs of depression and anxiety are also a red flag. Completely isolating themselves in the room, not wanting to go out with friends or go out and do anything social in real life is another red flag. The autism and ADHD and depression and anxiety are all becoming more prevalent, and we're having better screening tools to find it, but I can't help but think, and research is going out to find out how much social media and electronics are tied to all these problems, even ADHD, because if you think about it, ADHD, an unorganized mind that can't focus on something for longer than a minute or two, that is TikTok, that is YouTube Shorts, that is a video game, a small task followed by another small task. They're appealing to our addictive nature, and they are actually worsening our mental capacity overall in a lot of manners. It can be beneficial, but often if you spend too much time, it's not. And so signs of depression, sleeping too much, overeating or undereating, not wanting to go out, having outbursts of anger unnecessarily. If you give your child like a reasonable time limit of, all right, in 5 minutes, we got to get out of here and we're going to go do something else fun. Let's try. And you still can't get them to turn off the tablet or whatever, you have yourself an addicted child. There are certain ages that you should be at before you start becoming involved with social media, and that age should be 16. Development of the brain does not finish until age 25. That's where your prefrontal cortex, the logic, the ability to put yourself down in the future and like make decisions about yourself now for the future benefit, rather than just focusing on right now. You don't have that when you're younger than 20 generally. 16 should be the bare minimum of anybody having any social media. But the thing is that a lot of apps have social media attached to it. Even Duolingo has social media attached to it. Everything is adding a social aspect to it to bring more users in, because that's how they get financial success. Age 16 should be the minimum of having any social media. That way they have enough of a sense of self that they're going to be able to see all these other people without having to conform to them in so many different ways and feel bad about themselves. And I don't look that way. I don't act that, like I can't be that way yet, that kind of thing. Age 14 should be the minimum age where they have unsupervised electronic use or internet access. Other than that though, screen time overall, it should be limited throughout the day. Here's the way the American Academy of Pediatrics recommends, and then I'll tie in what I think is a good, reasonable accommodation at the end as well. American Academy of Pediatrics recommends 2 hours of screen time a day. That's it. They make exceptions for schoolwork and homework. That does not count. Schools and homework that you using the internet or using apps and stuff like that to try and save trees or make it easier for teachers, you got to do that. And the same thing, we got to do that for work. Also, socialization. You don't want to limit their ability to socialize in a real manner. FaceTime or video chatting and phone calls, that is real socialization. Text messaging, Snapchat, not so much. I don't count video chatting or telephone calls for my 2-hour limit. Also, my addition, I don't think that listening to music or podcasts or audiobooks should count either, because you can do that while you're jogging or working out in the yard or something else. I tell my patients that I'm fine with that. With those many exceptions, 2 hours should still be the limit, no matter how old you are. If you want more than 2 hours, here's another recommendation I make with my parents: to make an accommodation, to make a deal. All right, you want more than 2 hours? Fine, do some chores. How about you do some chores to earn more time? And that way it'll build in a natural evening out type of method. How about you do extra exercise? 60 minutes of play or physical exercise every day is what's recommended for all children. So if they do 2 hours, maybe of physical play and active activity or sports or whatever, fine, I'm fine with 3 hours of electronics. That sounds reasonable to me. Read a regular book where your attention span is utilized and you read a full chapter and your mind is being worked in a fun way. I don't mind if it's a comic book. You can read Dogman or Marvel as much as you want. So that's what I think is a good method, and I've had a lot of good feedback from my parents about implementing that, developing more of a balance. And I also tell parents to remember, it is your job to look out for your children. It is your job to keep them safe, but it is not your job to entertain them. That is not your job. You can help, but their imagination needs to be utilized, or else they will never use it. If you help them constantly, then they will become inept. Children are wired to connect. That's what they're meant to do. It starts as a baby when they start with their social smile at 2 months. They start, they look at you in their face and you smile and they smile. And it turns into games about making faces and getting them to giggle and eye-to-eye contact and interaction. That does not work the same as a screen. And it moves on to the face, making face game, then it moves on to jokes and interaction face-to-face. It doesn't work with a screen though, and it is all passive, and they become robotic-like if you utilize screens too early. Under age 2, no screen does anything for a baby or a toddler other than distract them for a couple minutes. It does not teach them, and most of the time, my developmentally delayed children that have speech delays, they end up having they're most often the ones with a lot of screen time even before 2 years old. So I want to tell parents that, and I also want to tell parents that look at yourselves too, because surveys have gone out and 17% of parents, even when they're in the midst of playing with their children, feel distracted by their phone often. 52% feel that they're sometimes distracted by their phones and by pings and alerts. It is a big problem amongst parents too, trying to be present. That's the problem with the phones, and having the whole world at access in your pocket is that you will always feel pulled away from the current ground that you're standing in towards somewhere else, the ether. That doesn't really exist. It exists, but it doesn't at the same time. So, to have good practice with your children, you also want to practice yourself well and try to not be as involved with your phone as you don't want them to be. That's what I would say, is to be present there as well. If something works and something's good for you, it is never easy. Things can be easy and it good for you, but it doesn't often work. But for something to work and it to be good for you, it is never easy. The internet and social media is going to be a part of their lives. You can't deny that. And that's one of the hardest things about what I'm trying to do and what I do daily, is that I'm not trying to cut out electronics. I'm not trying to cut out social media. I have social media. I have electronics. I play video games. It's a matter of balance. It's a matter of understanding limitations. If you drink too much water, you'll drown. Even water is too much. You eat everything in moderation, even including moderation.